Look down at your fingernails. Just for a second. You see them every single day. You cut them, you bite them, maybe you paint them, and you probably think they are just dead tissue. Keratin, biological decoration. Here is what most people never realize. Doctors check your nails during physical exams, not as an afterthought, as a diagnostic tool, because your nail matrix, that tiny factory hidden just beneath your cuticle, is one of the fastest dividing cell populations in your entire body. It is churning out new cells constantly, and that speed makes it incredibly sensitive. When something goes wrong inside you, whether it is a nutritional deficiency, a systemic illness, or a problem deep in your lungs, that matrix flinches, it stutters, and it leaves a mark in the nail plate that grows forward like a recording. A biological flight recorder sitting at the end of each finger. The ridges you blamed on aging. The color change you assumed was fungus. The shape you never even noticed shifting. Those are not cosmetic problems. They are messages, and most people have been ignoring them for years. Today we are counting down 5 nail signs, starting with the most common and harmless and ending with the one that can signal cancer months before any scan catches it. For each sign, I am going to show you exactly what causes it at the cellular level, which ones you can safely ignore, which ones demand blood work, and which ones mean you need a doctor now. By the end, you will know 2 self-tests you can do in seconds with nothing but your own hands. Let us start with the sign almost everyone has gotten wrong. Number 5, white spots. You have seen these your entire life. Little white flecks scattered across the nail plate. And at some point, someone told you it meant you were low on zinc. Maybe a parent, maybe a website. That explanation has been repeated so many times, it feels like settled science. It is not. Those spots are called punctate leukonychia, and they have almost nothing to do with what you are eating. Your nail grows from a hidden factory tucked just beneath your cuticle called the nail matrix. The cells there divide fast and stack keratin, the tough protein that makes up your nail, in tightly organized layers. Think of it like laying bricks in perfect rows. When you bump that finger against a counter, catch it in a drawer, or pick at the cuticle a little too aggressively, you disturb a small cluster of those cells mid-production. They lay down a patch of keratin that is jumbled instead of organized. Jumbled keratin scatters light instead of letting it pass through. White spot. That is all it is. A tiny construction error frozen into the nail plate. The reason no one connects the bump to the spot is timing. Your nail grows about 3 millimeters per month. So, a knock to the matrix today will not show up as a visible white spot until 6 to 8 weeks later. By then, you have completely forgotten the bump. You see the spot, you Google it, and zinc deficiency is the first result. When researchers actually tested this, measuring blood zinc levels in healthy people with these spots versus people without them, there was no meaningful difference. True zinc deficiency does affect nails, but it looks completely different. It turns the entire nail a diffuse milky white, not a few scattered dots. So, if you have a couple of white flecks right now, you can relax. Your nails are just keeping a record of minor injuries you have already forgotten. But not every nail change is this harmless. Number 4, spoon nails. Take a look at your fingernails from the side. They should have a gentle, slight curve downward. In some people, that curve slowly flattens out. Then it reverses. The nail becomes concave, dipping inward like a tiny bowl. Doctors call this koilonychia. You could call it a spoon nail because that is exactly what it looks like, a nail shaped like a miniature spoon. This one is not about bumps or bruises. This one is about iron. Your nail matrix is one of the most actively dividing tissues in your body, and cell division is expensive work. It requires iron. Iron is a key ingredient in the enzymes that drive those matrix cells to keep multiplying and stacking strong keratin. When your iron stores drop low enough, the matrix cannot build a structurally sound nail plate anymore. The keratin comes out thin, weak, and eventually the nail loses its ability to hold its own shape. It collapses inward. Here is what makes this sign so valuable. Spoon nails can show up when your ferritin, your stored iron, drops below about 20 micrograms per liter. That is often well before your hemoglobin falls low enough to officially qualify as anemia on a standard blood test. Your nail is waving a flag before the lab work even catches the problem. There is a simple way to check. Place a single drop of water on the surface of the nail. On a normal nail, it rolls right off. On a true spoon nail, the drop sits there, cradled in the concavity. If that drop stays put, that is worth a blood test. Iron deficiency is treatable. It is common, and your nails might be showing it before anything else does. Number 3, horizontal ridges. Run your thumb across one of your fingernails. Vertical ridges, the ones that run from cuticle to tip, are normal. They show up with age and they are harmless, but horizontal ridges, grooves that run side to side across the nail, are a completely different story. These are called Bowes lines, and they are not a quirk of aging. They are a scar left behind by your body shutting down non-essential operations during a crisis. Here is the logic. Your nail matrix burns through energy and nutrients to keep dividing. When your body faces a severe stress event, a high fever, a major surgery, a round of chemotherapy, a period of extreme nutritional deprivation, it makes a cold calculation. Nail growth is not essential for survival, so the matrix goes quiet. Cell division slows or stops completely. When the crisis passes and growth resumes, the pause leaves behind a visible groove stamped across the nail plate like a line in a tree ring. The width of that groove tells you how long the illness lasted. The depth tells you how severe it was. And because the nail grows at a steady rate of roughly 1/10 of a millimeter per day, a doctor can measure how far that line sits from the cuticle and work backward to estimate when the event happened. The nail becomes a timeline. One critical detail separates serious from trivial. If a Bowes line appears on only one nail, it is probably local trauma. You jammed a finger and that single matrix took a hit. But if the same groove appears across all 20 nails at the same depth, that is systemic. Something hit your entire body hard enough to pause nail production everywhere at once. After the first waves of COVID-19, doctors documented a surge of Bowes lines appearing on patients 2 to 3 months post-infection. People who had recovered and felt fine were carrying a visible timestamp of the illness right on their hands. Up to this point, every sign we have covered is either harmless or tied to something treatable. White spots are cosmetic. Spoon nails point to iron deficiency. Bowes lines record a past event your body has already survived. From here, the stakes change. Number 2, yellow nails. Your nails have a natural color. It is a translucent pinkish tone that comes from the blood flowing through the nail bed underneath. So when nails turn a deep yellow or yellow-green, thicken noticeably, and seem to almost stop growing, most people assume fungus. They buy antifungal cream. They try tea tree oil. They see a podiatrist, and nothing works. Months pass, sometimes years. The nails stay yellow, stay thick, and refuse to respond to treatment. That is because it was never fungus. Yellow nail syndrome is a systemic condition driven by a failing lymphatic system. Your lymphatic system is a network of tiny vessels that drains excess fluid and protein from your tissues and returns it to your bloodstream. When that drainage fails, protein-rich fluid backs up. It accumulates in the nail bed, choking off normal growth and producing that characteristic thick yellow discoloration. The cuticle disappears. The lunula, that pale half moon at the base of your nail, vanishes. Growth rate drops below 0.2 millimeters per week, when a healthy nail grows 2 to 5 times faster than that. But the nails are not the real problem. They are the visible surface of something deeper. 80% of people with yellow nail syndrome have lymphedema, swelling in the limbs from that same lymphatic failure. 36% have pleural effusions, fluid collecting around the lungs. Many have chronic sinusitis or bronchiectasis, a permanent widening of the airways. The nails were never a cosmetic issue. They were a signal from the lungs and the lymphatic system that something is structurally wrong. Number 1, clubbing. Put your 2 index fingers together, nail to nail, like a mirror image. Look at the gap between the nail beds. In a healthy finger, you will see a small diamond-shaped window of light between the 2 nails. That is the Shamroth window test. If that diamond disappears, if the nails press flat against each other with no gap at all, that is clubbing. And clubbing is the most medically urgent sign on this list. In clubbing, the fingertips swell and bulge. The nail curves downward over the enlarged tip like it is wrapping around a drumstick. It looks dramatic when advanced, but in early stages, the change is subtle enough to miss. The cause is chronic oxygen deprivation. When your blood oxygen runs low for an extended period, your body releases a growth signal called VEGF, vascular endothelial growth factor. Normally, your lungs filter this signal out before it reaches your fingers. But when the lungs are diseased, or when blood bypasses them through an abnormal heart pathway, VEGF floods into your fingertips unchecked. It triggers a burst of connective tissue growth and increased blood flow in the fingertip. The tissue swells. The nail reshapes over it. 35% of clubbing cases are associated with lung cancer. The rest are linked to pulmonary fibrosis, cyanotic heart disease, liver cirrhosis, and inflammatory bowel disease. In aggressive lung malignancies, clubbing can develop in as little as 2 weeks, making it one of the fastest visible external markers of internal cancer. In some documented cases, it was the very first abnormality anyone noticed, appearing months before a scan revealed the tumor. Think about what just happened. We started at white spots, a cosmetic nothing caused by a bump you forgot about weeks ago. We ended at clubbing, a visible marker that can signal lung cancer months before any scan picks it up. 5 signs, 5 completely different depths into the body, and every single one of them is visible right now on your own hands. You walked into this thinking nails were dead tissue. They are not. They are a living record, continuously updated by a matrix that reacts to everything from a missing mineral in your blood to a tumor forming in your lung. The flight recorder never stops writing. You now know 2 tests you can do in seconds with nothing but your own hands. The water drop test. Place a drop on your nail. If it stays cradled there instead of rolling off, get your iron checked. The Shamroth window test. Press your index fingernails together back to back. If the diamond-shaped gap between them disappears, that warrants urgent evaluation. And remember the single rule that separates harmless from serious. 1 nail, probably local. All 20 nails at once. That is systemic. That is your body telling you something is happening everywhere, not just at the fingertip. The skill you have now is not about fear. It is about literacy. Your body does not suffer quietly. It writes messages in the tissues you see every single day. Most people never learn to read them. The next time you glance down at your nails, absent-minded, waiting for your coffee, or sitting in traffic, you will not see what you used to see. Same glance, completely different meaning.